Well, it looks like there's a new player in the battle against COVID-19, and it's called Aviptadil. Welcome back to my channel. My name is Dr. Anwar Youssef Dunbar. This is Big Discussions 76, Science and Technology. First of all, please like this video, please share it, and please subscribe to my channel. Well, I'm back with a quick video. Well, what I hope will be a quick video. And this is another video that I did not expect to shoot when I rolled out of bed this morning. But in this information age, information is fast moving, and with these smart devices, the information is coming to us very, very quickly. So just like I mentioned over on my sports channel, I get articles on my phone pretty much daily, dealing with one thing or another, and oftentimes I get science articles, and it just so happened that this morning my newsfeed brought up an article that's very, very applicable to what's happening right now regarding the coronavirus slash COVID-19. Interestingly, this article fits very, very nicely into my own personal wheelhouse. So a couple of videos ago, it might have been the last one, I talked about how I'm in a group of people now, arguably a second family, that right here on YouTube that's talking about the coronavirus quite a bit, specifically the science of it. And I thought about how I could add to these discussions from a pharmacological and toxicological perspective. And so it turns out that there's a new player or a new sheriff in town in the battle against the coronavirus slash COVID-19, and it's called Aviptadil. A lot of these drugs are tongue twisters, so it's called Aviptadil. The other name for it is RF-100. And the article that was brought up on my phone was from the New York Post, and it is entitled "Critically Ill COVID-19 Patients Make Quick Recovery with Treatment, RLF-100." So that's Aviptadil. So I did a quick search on it, a quick Google search, and there's a lot of information on this molecule. And I found another article, and I'm going to leave all these articles in the description box below. But this article is entitled RLF-100, Aviptadil Trial Shows Rapid Recovery in COVID-19 Patients. And so I'm just going to go through this very quickly and just try to pull out the main points. So it turns out that Aviptadil is it's a formulation of a vasoactive intestinal polypeptide. So it's a polypeptide. It's not a small molecule. So if you go back to part 1 of my pharmacology and toxicology, the Sister Sciences Remastered video, in that video I made the distinction between small molecules and large molecules. So a small molecule, in terms of size, is roughly 900 Daltons or 900 grams per mole. So that's its size. And a large molecule is roughly 3,000 to 150,000 Daltons or grams per mole. So that's a much larger molecule. And so it turns out that For the small molecules, you can usually take them orally, and that molecule will get absorbed by your gastrointestinal tract, so your small intestine. And larger molecules usually have to be injected straight into your bloodstream. So when I saw this, that's one of the things I thought about, is that how is it going to be delivered to the site of action? And so in terms of the site of action, what we know is that the virus seems to like the ACE2 receptor, so the angiotensin converting enzyme receptor. And so the virus seems to enter through the respiratory tract. So it likes to go through the lung, which is why they want us all to wear masks to protect from droplets and aerosols, viral droplets and aerosols. So I asked myself, okay, are they giving this to patients via inhalation? Because some medications can be given as aerosols or gases via inhalation, but it turns out that this is going to be injected IV. And so that means once the molecule is injected, it has to travel to the pulmonary blood vessels there. So the other thing I thought about was that this is for recovery. So we know that there are patients that are experiencing acute respiratory failure or distress, and this is why they have to be intubated and put on ventilation. And so we know that this is also due to inflammation. And so what this vasoactive peptide, it seems to be doing is that it's decreasing inflammation. So I'm saying all this to say that this is not inhibiting replication of the virus, but this seems to be a treatment on the back end once patients are infected with the virus. This is not a vaccine. This is not an antiviral. This is mediating the immune system of the patient and minimizing the symptoms that the virus is causing. So be on the lookout for this medication. If this medication shows promise, this could help in terms of patient recovery. And this will help while we wait on a vaccine or a very strong antiviral medication. So I just wanted to make a quick video on this. Any medication that we have that can help combat this virus will be helpful in the overall our overall recovery from this pandemic that we're in. And this information is coming out daily, so as the information comes out, you can expect to see more video content from me. So with that, I'm going to stop. Please like this video, please share it, and please subscribe to my channel. Please let me know if you have any questions or comments in the comments section below. I'm going to leave all the articles and information that I found on Aviptadil in the description box below. And as always, remember that your attitude determines your altitude. Take care, and I will talk to you the next time. Bye-bye.